keynote speaker, Dr. Fatih Yalcin. Dr. Fatih Yalcin, University of California, San Francisco, USA. Professor Fatih Yalcin is currently from the Department of Cardiology at Mustafa Kemal University, Antioch, Turkey. He is Fulbright visiting professor in Johns Hopkins University since 2009. He has recently been a visiting professor at UCSF Health. He completed his MD in the University of Akdeniz, Mediterranean, Antalya, Turkey in 1989. He was resident in Min of Health, Ankara Emergency Hospital, Ankara, Turkey from 1990 to 1995. He was fellow at the Leeds University Hospitals, Leeds, UK, Cleveland Clinic Foundation, Cleveland, OH, USA. He also worked in Beskent University, Adana, Turkey. He has many publications in peer-reviewed international journals. Thank you. Dr. Yalcin, you can proceed.
Thanks a lot, George, for this
Thank you.
very nice presentation. My speech topic is stress-related heart disease. That's very popular subject in cardiology recently. We have seen a lot of emotional cardiomyopathy, which have some special aspects, including apical ballooning, one segmental ballooning on the heart, and the other segment is hyper contractile and predominant. So we usually focus on the segmental morphological deformation of the heart geometry as well as functional abnormality, which could include a variety of segments. Similar basal hypercontractility we previously published in hypertensive patients, similar to acute stress cardiomyopathy. We do not always see the very regular border of the myocardium on human being. That's why we described stressed heart morphology in 2009. As you can see on the picture, there is a huge segmental...
Excuse me, we cannot see your presentation. Could you share your screen?
Sorry. Now, can you see it?
Yes, we can see it now. Wonderful.
We can.
Yes.
Thank you.
Yeah, please proceed.
Okay. And we noticed the very discordance between the different segments of the heart, cardiac myocardium, and we described stressed heart morphology. And we have noticed acute stress cardiomyopathy has similar functional and geometrical aspects. As you can see on the screen, during systole, there is a remarkable basal hypercontractility and cavity obliteration. In contrast, mid-apical ballooning can be seen. In these patients, we don't see any coronary abnormalities, despite this remarkable apical enlargement, which developed acutely. That's why 1 year later, we described this kind of functional and geometrical aspects could be seen both chronic pathologies as well as acute stress cardiomyopathy. And we described this as adaptive phase of remodeling prior to heart failure. However, we do not always regular morphology in hypertensive patients like this. We can see very remarkable abnormal septal segments on the base, as you can see in different demonstrations here. This is very remarkable. So we focused on the emotional part. This could be also chronic. In other words, we do not believe acute stress cardiomyopathy is developed suddenly. Of course, clinically looks very sudden, but it should be underlying long-standing mechanism before acute decompensation. Why we believe that? Because we completed an animal validation study in regards to remodeling, and we have shown basal septal hypertrophy in mice after transaortic constriction. But this covers half of the total remodeling process. In other words, this predominant septal base develops until half of the total remodeling process. And we pointed out the importance of segmental discordance between apical part and basal part. And we do also believe that the discordance of these two parts leads to heart failure, chronic heart failure. And we recently presented in ACC 2023 this year, in this month, increased gradients before heart failure developments in those kind of patients. Therefore, there are lots of difference between animal and human cardiac remodeling. As you can see, basal septal hypertrophy is the key part for the initial development of segmental remodeling. Why? It's why we describe this as the early imaging biomarker. Again, this is a picture of patient with acute stress cardiomyopathy, and you can see very predominant septal base. It is very hard to say this patient has previously undiagnosed hypertension, but there are lots of papers showing increased sympathetic amines, noradrenaline, adrenaline, the others are very high. It's impossible that those patients are free of hypertension, but clinically, during the diagnosis, we don't see any, of course, increased blood pressure because they have cardiomyopathy and decompensation. As the result, according to the Johns Hopkins animal validation study, acute stress cardiomyopathy could possibly be developed over a chronic hypertensive disease or stressed heart morphology. However, undiagnosed previous hypertension is extremely common according to World Health Organization data, and possibly those patients couldn't be diagnosed earlier before the acute episodic decompensation. We still continue to focus on the relation between stress and heart disease, and we continue our scientific activities on this topic. We recently pointed out again the importance of segmental remodeling and the importance of segment measurements during the clinical practice instead of cross-sectional measurements. Again, I'd like to thank you for this beautiful meeting and giving me chance to talk. Thank you.
Hey, Dr. Yalcin, thank you for your presentation. I'm the moderator for this morning session, and I'm from Hong Kong Association of Psychology. So I just want to see if anyone here has any question for Dr. Yalcin. So if there's no question, I have just one question for you, Dr. Yalcin. So based on what you presented, what do you think moving forward, based on what you have just said, what do you think are the key aspects that we can, carry forward towards the upcoming, initiatives, in terms of cardiology?
Actually, all those parts of our previous 2-decade observations were not planned. Each project and completing that particular project brought another project. Therefore, now after showing the increased gradients, these patients with adaptive phase of remodeling, we are focusing on the energetics, myocardial energetics, to document between the morphology, function, as well as energetics in this particular patients in the future.
Right. Thank you. Thank you so much for your insight. So I'm sure we can learn a lot from your presentation. Thank you so much, Dr. Yalcin. All right.
Thank you, Doctor.